addressing workforce capacity and safety. And I think contextualizing the questions to each topic, hopefully we'll be able to get through all of them. And at the very end, just as a reminder for everybody, there's going to be an open Q&A for the entire panelists. So the next speaker is Dr. Cercelli, who's going to be talking specifically about the last question of safety and workforce capacity. So Dr. Cercelli.
Hi everyone, hi everybody. I'm sorry. I'll talk about workforce capacity and safety, and I show how we use PPE. Next one, please. The first case is COVID development in family health teams in emergency department, but in a few weeks conquered the whole Italian territory. A lot of health care workers were involved in COVID-19. 3 days ago, more than 2,600 patients are COVID-19 positive. It's about 8.3% of the total. To contrast this war, we have to stop, as my colleagues has just said, all the elective surgery, all the elective procedures like colonoscopy, angiography, and also ambulatory outpatients. We continue only emergency surgery, emergency procedures like thrombectomy for stroke, angioembolization for aneurysm or exsanguinating patient, PTCA, etc., and cancer patients. This can reduce virus transmission, but can permit a large number of nurses and medical staff that are free for COVID wards and new wards that are created in this situation. This is our personal protective equipment we use. This is me. It's a surgical mask when we stay in the isolated wards or ICU away from the patient more than 1 meter. When we have to perform operation or invasive procedures, we use eye liver protection masks, FFP2 or FFP3. Surgical gauze is okay if it's liquid repellent, 2 pairs of nitrile glues, surgical cap, of course, for invasive procedures or tracheal intubation, also ECMO cannulation, or also non-invasive ventilation that can generate aerosol, we use eye protective suit. And of course, surgical boot covers and important vision shield to protect our eyes. Different dress code. This is 3 different dress codes because Our Lady want to be different, but are safe. This is the Italian style. Today, we have a PCR test only when we are symptomatic. This is not true in all the Italian region because health system is have a federal organization, and so it's different from in my region from other region. When we feeling sick, we have to stay or come back to home with a fever more than 37.5 degrees, 99.5 Fahrenheit, and cough. There is a law, an Italian law in promulgating the 3.8 that say you have to go back. You can stay at home, but quarantine is recommended. Running out the personal protective equipment is a risk, a real risk. It's an important problem because now all the world demand PPE, and most of the production is in China and India. in our country, a lot of industry start to change production towards masks, gloves, but we need some weeks to see this kind of change. There is not a unique solution. Civil protection assistant try to manage supplies, but it's not simple. We have to remember that we have to use only necessary equipment, and we also ask anyone who can help us. For example, private dentistry clinic that in this moment are closed, they gave us some masks. What advice I have to gave to myself 2 weeks ago? 3 weeks ago, we were looking for ECMO circuits. And really, we found them. But only few people really require extracorporeal oxygenation. Nobody know how many, maybe 2-3% of ICU patients. This is not a so big number. It's important that it's time and resources consuming, and lymphopenia is a problem that you have to pay attention. What we need is mechanical ventilators. So, take home message. The problem is mechanical ventilators, and the problem in protecting the protectors. Protect yourself to continue to cure. Good luck to everyone. Thank you very much.
Thank you. Larry, I'll yield the floor to you for collecting questions.
Okay, great. So we do have some. So going back to the previous question, how are you protecting healthcare workers, so doctors, nurses, and technologists from exposure during this pandemic period? And given the high percentage of patients that are coming in for testing at your hospital for COVID-19, are the majority of people wearing PPE prophylactically at all times?
Yeah, this time a lot of the normal people and outpatient wear normal surgical mask. It's standard in our city, but I think all in the Italian territory.
So our lab has recently looked up some numbers and found that about 8% of healthcare, 8% of the cases of COVID-19 in Italy are from healthcare workers, and that in cases where PPE is becoming scarce, that the number of healthcare workers who are getting infected actually is increasing. I'm going to try to get Dr. Amy Price, who did the research, to give me that exact number. But I think that number was 8.3% of total cases. So with that number in mind, when you ran out of PPE, did you find you were able to have workarounds to that, either sanitizing or reusing? And if so, what were your workarounds?
It's a problem because no one at this moment in the war, I think, have the solution. You have to check for the solution, resource, ask to friends, ask to private clinic that at this moment are closed, ask to dentistry, Protezione Civile, that is the most important institution in our country, have problem at this moment. So I think it's not a simple workaround.